My name is Carleen Miller. I'm a very proud Tanarong woman and I am employed as the Aboriginal Liaison Officer at the Royal Dental Hospital of Melbourne, been in this role for the past 5 years.
Excellent.
My name is Rebecca Crawford. I'm the Aboriginal Community Development Worker and I'm located in the Health Promotion Team at DHSV.
I remember very clearly I was working for Aboriginal Community Elders Services, and we took a group of our elders to the Aborigines Advancement League and watched the apology up on the big screen with hundreds of Aboriginal people in the room.
At the time I was working in Broken Hill in New South Wales, and I was an Aboriginal caseworker with the Department of Community Services. And there are a lot of Aboriginal workers there, about 6, and so we went into the common room and sat down and watched the apology, and it was a very sort of sacred moment, but a very cleansing one.
I personally think it's that the apology is the beginning. We've still got a long way to go to reconciliation, and there are a lot of families still very traumatised, second, third generation stolen, that are still feeling the impact. That transgenerational trauma is still with us, particularly in Victoria. There are more Victorian people affected by the stolen generations than other Indigenous Australians.
Mm.
Yeah, I think what's important about it is that there's acknowledgement that it happened, and because there are a lot of things that Aboriginal people struggle with these days, and a lot of those things are due to the disconnection from their culture and their family. And my role as an Aboriginal community development worker is to work with communities to overcome the difficulties that still exist for people in accessing services, but also changing the views of non-Aboriginal people and bringing everybody together in a way where we can find solutions together and improve things.
Primarily my role is to assist Aboriginal and Torres Strait Islander people to access the services here, to provide advocacy and a sense of safety, cultural safety, when they're attending the hospital for appointments. I do have some people who access the services that are stolen generation. I was here last week with a patient to support her through the process whose life has been traumatised by her experiences.
So I work in the Health Promotion Team, and my job I work within the Healthy Families, Healthy Smiles team and the Smiles from Wales, and basically work with Aboriginal community controlled health organisations to develop approaches to improve oral health in our communities, because it's very bad. It's been neglected for a long time, so my role is to bring it out of the shadows and talk to organisations about how we can improve it and how DHSV can bring that about.